Hello everyone, for today we are going to discuss the blood supply and lymphatics of the head and neck. It is a group discussion of Group 7 for General Anatomy 2 lecture class. The team is composed of Josh, Jamelisa, Giselle, Maxine, yours truly Romel, and Fritz. Now for the objectives of the report, number 1 is to provide a comprehensive understanding of the arterial blood supply and venous drainage in the head and neck region. Another objective is to explain the anatomical distribution of the major arteries and veins in the head and neck. Next is to describe the pathways and connections of the lymphatic vessels and the nodes in the head and neck. Next is to discuss the functional and clinical significance of blood supply and lymphatic drainage in the head and neck, including their role in disease processes and medical procedures. The last objective of this report is to highlight the clinical implications of blood supply and lymphatics in relation to common medical conditions.
Greetings, everyone. I am Vanna Maxine Cruz Ontolan, and I will start with an overview of the circulatory and lymphatic system. A recap: the circulatory system is a closed network of organs and vessels responsible for transporting blood throughout the body. Its primary functions include delivering nutrients, immune factors, and oxygen to tissues, as well as carrying away waste products for elimination. The heart acts as a four-chambered pump, propelling the blood throughout the body. The oxygenated blood enters the right atrium through the superior and inferior vena cava, then passes through the tricuspid valve to reach the right ventricle. When the heart contracts, this blood is pumped through the pulmonary arteries to the lungs, where it becomes oxygenated at the alveoli. The oxygenated blood returns to the heart via the pulmonary veins and is received at the left atrium, passing through the mitral valve to enter the left ventricle. When the heart contracts again, the oxygenated blood is pumped to the body through arteries. The arteries branch out from the aorta, the first and largest artery. They progressively decrease in size, becoming arterioles, and ultimately connect to capillaries, forming a network of smaller vessels. Venules connect capillaries and increase in size to form veins, which join together into larger vessels as they transport blood back to the heart. The superior and inferior vena cava, the largest veins, return blood to the right atrium. In addition to the heart and vessels, several organs play crucial roles in the circulatory system. The kidneys filter the blood, removing waste products and eliminating them through urine. The liver also filters the blood and removes damaged or defective red blood cells. The spleen filters and stores blood, removes damaged red blood cells, and acts as a reservoir for immune factors. These organs serve as important filtering structures, trapping microorganisms and maintaining a microorganism free environment in the blood. Overall, the circulatory system ensures the efficient distribution of essential substances and the elimination of waste products, contributing to the overall functioning and health of the body. The lymphatic system is also a network of vessels that run throughout the body. However, these vessels do not form a full circulating system and are not pressurized by the heart. Rather, the lymphatic system is an open system with the fluid moving in one direction from the extremities toward two drainage points into veins just above the heart. Lymphatic fluids move more slowly than blood because they are not pressurized. Small lymph capillaries interact with blood capillaries in the interstitial spaces in tissues. Fluids from the tissues enter the lymph capillaries and are drained away. These fluids, termed lymph, also contain large numbers of white blood cells. The lymphatic system contains two types of lymphoid tissues: the primary lymphoid tissue includes bone marrow and the thymus. The secondary lymphoid tissues include the spleen, lymph nodes, and several areas of diffuse lymphoid tissues underlying epithelial membranes. The spleen, an encapsulated structure, filters blood and captures pathogens and antigens that pass into it. The spleen contains specialized macrophages and dendritic cells that are crucial for antigen presentation, a mechanism critical for activation of T lymphocytes and B lymphocytes. Lymph nodes are bean shaped organs situated throughout the body. These structures contain areas called germinal centers that are rich in B and T lymphocytes. The lymph nodes also contain macrophages and dendritic cells for antigen presentation. Lymph from nearby tissues enter the lymph node through afferent lymphatic vessels and encounters these lymphocytes as it passes through. The lymph exits the lymph node through the efferent lymphatic vessel.
And now, let's talk about the major blood supply of the head and neck. So, the main arterial supply of the head and neck is derived from the branches of the carotid and subclavian arteries, branches of external and internal carotid arteries. Additional arteries arise from the branches of the subclavian artery, particularly the vertebral artery and the thyrocervical trunk. Carotid arteries. So as you can see in the illustration, it is presented at the sternoclavicular joint to just behind the mandible and the mandibular condyle. The carotid arteries are the main blood arteries that deliver blood to the brain and face. The cervical portion of the common carotid artery is similar on both sides. Each lies within the carotid sheath of deep cervical fascia, together with the internal jugular vein and vagus nerve. In the lower part of the neck, the arteries are separated by a narrow gap that contains the trachea, and higher up, they are separated by the thyroid gland, larynx, and pharynx. At the level of the upper border of the thyroid cartilage, the common carotid artery bifurcates into external and internal carotid arteries. So now, let's talk about the external carotid arteries. So the external carotid arteries, it passes upwards on either side of the neck, initially slightly forwards, then backwards and laterally. It has several branches that will supply the head and neck. In children, the external carotid is smaller than the internal carotid, but in adults, the two are of almost equal size. At its origin, it is the carotid triangle and lies anteromedial to the internal carotid artery. So the external carotid artery has 8 main branches distributed to the head and neck: the superior thyroid artery, the ascending pharyngeal artery, lingual artery, facial artery, occipital artery, posterior auricular artery, maxillary artery, and lastly, the superficial temporal artery. Let's now talk about the branches of the external carotid arteries. First, the superior thyroid artery. It is the first branch of the external carotid artery and arises from the anterior surface of the external carotid just below the level of the greater cornu of the hyoid bone. It supplies the thyroid gland, cricothyroid, and infrahyoid muscles, a part of the sternocleidomastoid muscle in the upper larynx. It is located in the anterior neck deep to the infrahyoid muscles. The superior thyroid artery gives off 5 branches that contribute to the blood supply of the muscles and the viscera of the neck. These are granular branches, infrahyoid artery, superior laryngeal artery, sternocleidomastoid artery, and cricothyroid artery. First is the granular branches. It supplies the upper half of the thyroid gland. It can be individually defined as the anterior, posterior, and lateral branches, and anastomoses with those of the inferior thyroid artery to complete the vascular network that feeds the whole gland. The infrahyoid artery. It is a small branch that runs along the lower border of the hyoid bone, deep to the thyrohyoid and anastomosis, with its fellow of the opposite side to supply the infrahyoid strap muscles, which includes the omohyoid, sternohyoid, sternothyroid, and thyrohyoid. Next, the superior laryngeal artery. It is deep to the thyrohyoid. It pierces the lower part of thyrohyoid membrane to supply the tissues of the upper part of the larynx. It anastomoses with the inferior laryngeal artery from the inferior thyroid artery to complete the vascular network to the larynx. Sternocleidomastoid artery. It descends laterally across the carotid sheath and supplies the middle region of the sternocleidomastoid. Lastly, the cricothyroid artery. It crosses high on the anterior cricothyroid ligament, anastomoses with its fellow of the opposite side, and supplies cricothyroid. And now the second branch of the sternal carotid artery is the ascending pharyngeal artery. It is the smallest branch of the external carotid artery. It is a long, slender vessel which arises from the medial or deep surface of the external carotid artery. The artery branch of the external carotid artery that runs through the neck on each side of the throat. The ascending pharyngeal artery is crossed by styloglossus and stylopharyngeus, and longus capitis lies posterior to it. It gives off numerous small branches to supply longus capitis and longus colli, the sympathetic trunk, the hypoglossal, glossopharyngeal and vagus nerves, and some of the cervical lymph nodes. The ascending pharyngeal artery gives off three branches that contribute to the blood supply of the pharynx, prevertebral muscles, middle ear, and dura mater. The branches of the artery are the pharyngeal, inferior, tympanic, and meningeal branches. The pharyngeal artery. It gives off 3 or 4 branches to supply the constrictor muscle of the pharynx and stylopharyngeus. A variable ramus supplies the palate and may replace the ascending palatine branch of the facial artery. Inferior tympanic artery is a small branch that traverses the temporal canaliculus with the tympanic branch of the glossopharyngeal nerve and supplies the middle wall of the tympanic cavity. Lastly, the meningeal branches are small vessels that supply the nerves that traverse the foramen lacerum, jugular foramen and hypoglossal canal, and the associated dura mater and adjoining bone. The next branch of the external carotid arteries are the lingual artery and the facial artery. The lingual artery is formed by anteromedial aspect of the external carotid artery at the level of the great cornu of the hyoid bone. It is the principal artery supplying the tongue, sublingual gland, gingiva, and oral mucosa of the floor of the mouth. Facial artery. It is within the carotid triangle. It arises from the external carotid artery immediately above the lingual artery. In the face, the artery is deep to skin, the fat of the cheek, and near the angle of the mouth, zygomaticus major and risorius, and superficial to buccinator and levator anguli oris. In the neck, at its origin, it is covered only by the skin, platysma, fascia, and often by the hypoglossal nerve. It runs up and forwards, deep to digastric and stylohyoid. So first, we will going to talk about the branches of facial artery in the face. It is named branches of the face are the premasteric artery, the superior inferior labial arteries, and the lateral nasal artery. The part of the artery distal to its terminal branch is called the angular artery. The angular artery is essentially a terminal branch of the facial artery. The branches of the vessel are closely attached to the angular head of the levator labii superioris. The angular vein also accompanies the artery and its path. Premasteric artery is small and inconstant. When present, it passes upwards along the anterior border of the masseter and supplies the surrounding tissues. Inferior labial artery arises near the angle of the mouth, passes upwards and forwards under the pressor anguli oris, and then penetrates orbicularis oris to run sinuously near the margin of the lower lip, between the muscle and the mucous membrane. It supplies the mucous membrane and muscles of the lower lip and also supplies the labial glands. The vessel anastomosis with the artery of the opposite side and inferior alveolar artery, which is the mental branch. The superior labial artery is larger and more tortuous than the inferior labial artery. It pursues a similar course along the superior labial margin between the mucous membrane and orbicularis oris, anastomosis with its contralateral fellow, and supplies the upper lip. And lastly, the lateral nasal artery. It ascends along the lateral aspect of the nose. It supplies numerous structures including the dorsum of the nose, the alar part of the nose, and anastomosis with its contralateral fellow. The infraorbital branch of the internal maxillary artery as well as the dorsal nasal branch of the ophthalmic artery. Next, the branch of the facial artery in the neck. Its branches in the neck are ascending palatine, tonsillar artery, submental artery, and granular branches. The ascending palatine artery. It passes up between styloglossus and stylopharyngeus to reach the side of the pharynx, along which ascends between the superior constrict of the pharynx and medial pterygoid towards the cranial base. It bifurcates near levator veli palatini. The tonsillar artery ascends between the styloglossus and the medial pterygoid muscles before piercing the superior pharyngeal constrictor to reach the palatine tonsil. It provides the main blood supply to the palatine tonsil. Next, submental artery. It is the largest cervical branch that is situated in the facial artery. The branch is given off just as the facial artery passes through the submandibular gland. The vessel passes anteriorly on the top of the mylohyoid muscle, beneath the digastric muscle and just inferior to the body of the mandible. The artery supplies the muscle surrounding this region and anastomosis with the sublingual artery as well as the inferior alveolar artery, which the mylohyoid branch. The submental artery also divides into the superficial and deep branch. The superficial branch anastomosis with the inferior labial artery. The deep branch also anastomosis with the inferior labial artery as well as the mental branch of the inferior alveolar artery. The next branch of the external carotid artery is the occipital artery, posterior auricular artery, and the maxillary artery. So the occipital artery is derived from the posterior portion of the external carotid artery located in the posterior portion of the neck and the occipital region of the head. It runs posteriorly and superiorly deep into the digastric muscles, posterior belly. The upper and lower sternocleidomastoid branches are the main branch of the occipital artery. The occipital artery has two main branches, which is the upper and lower, to the upper part of sternocleidomastoid in the neck. The lower branch arises near the origin of the occipital artery and may sometimes arise directly from the external carotid artery. It descends backwards over the hypoglossal nerve and internal jugular vein, enters sternocleidomastoid and anastomosis with the sternocleidomastoid branch of the superior thyroid artery. The upper branch arises as the occipital artery crosses the accessory nerve and runs down the back and backwards superficial to the internal jugular vein. It enters the deep surface of sternocleidomastoid with the accessory nerve. Posterior auricular artery comes from the rear side of the external carotid artery above the posterior belly of the digastric. It rises in the neck between the parotid gland and the styloid process. It supplies the cranial surface of the auricular via its auricular branch, and the occipital belly of occipitofrontalis and the scalp behind and above the auricular via its occipital branch. While in the neck, it provides branches to supply digastric, stylohyoid, sternocleidomastoid, and the parotid gland. It also gives origin to the stylomastoid artery, described as an indirect branch of the posterior auricular artery in about a third of subjects, which enters the stylomastoid foramen to supply the facial nerve, tympanic cavity, mastoid antrum air cells, and semicircular canals. Maxillary artery. It is the largest of the two terminal branches that originates within the parotid gland from the external carotid artery. The maxillary artery originates deep to the neck of the mandible. On its course, the maxillary artery provides a number of branches that supply many structures within the head and face. The main function of the maxillary artery is to supply the blood to the maxilla and mandible, deep facial areas, cerebral dura mater or the meninges, and nasal cavity. The maxillary artery has three branches that supply the face, namely the mental, buccal, and infraorbital arteries. The mental artery. It arises from the first part of the maxillary artery as a terminal branch of the inferior alveolar artery. It emerges on the face from the mandibular canal and at the mental foramen, supplies muscle and skin in the chin region, and anastomosis with the inferior labial and submental arteries. The buccal artery is a small artery of the head and a branch of the second part of the maxillary artery, and supplies both the buccinator muscle and cheek. The infraorbital artery. It arises from the third part of the maxillary artery. It runs through the infraorbital foramen and on the face, supplying the lower eyelid, the lateral aspect of the nose, and the upper lip. The last branch of the external carotid artery is the superficial temporal artery. The superficial temporal artery is a smaller terminal branch of the external carotid artery. It also appears in the material of the parotid gland, which is located behind the mandible's neck. The artery is accompanied by the corresponding veins and by the auriculotemporal nerve, which lies just posterior to it. The superficial temporal artery supplies the skin and the muscles at the side of the face and in the scalp, the parotid gland, and the temporomandibular joint. The name branches of the superficial temporal artery are the transverse facial, auricular, zygomatico-orbital, middle temporal, frontal, and parietal arteries. First, the transverse facial artery. It arises before the superficial temporal artery emerges from the parotid gland. The transverse facial artery continues its course parallel to the zygomatic process, giving off several branches that supply the parotid duct, masseter muscles, and the adjacent skin. The auricular artery are distributed to the lobule and lateral surface of the auricle and to the external acoustic meatus. Next, the zygomatico-orbital artery. It may arise independently from the superficial temporal artery or from its middle temporal or parietal branches. It supplies orbicularis oculi and anastomosis with the lacrimal and palpebral branches of the ophthalmic artery. The middle temporal artery arises just above the zygomatic arc and perforates the temporal fascia to supply temporalis, and it gives branches to temporalis and anastomosis with the deep temporal branches of the internal maxillary artery. The frontal branch passes upwards towards the frontal tuberosity and supplies the muscles, skin, and pericranium in this region. And lastly, the parietal branch is larger than the frontal branch of the superficial temporal artery. It curves upwards and backwards, remains superficial to the temporal fascia, and anastomosis with its contralateral fellow and with the posterior auricular and occipital arteries. The next blood supply of the head and neck is the internal carotid artery. The internal carotid artery is a large branch of the common carotid artery that supplies blood to the numerous areas of the head, the most important of which is the brain. It ascends the neck anterior to the transverse processes of the upper three cervical vertebrae and enters the cranial cavity through the carotid canal in the petrous section of the temporal bone. The internal carotid artery supplies most of the ipsilateral cerebral hemisphere, eye and accessory organs, forehead, and in part, the nose. The internal artery is initially superficial in the carotid triangle and then passes deeper medial to the posterior belly of digastric. It terminates below the anterior perforated subtons by division into the anterior and middle cerebral arteries. The artery has no branches in the neck. It may be divided conveniently into cervical, petrous, carnivus, and the cerebral parts. There are 7 segment pathways in internal carotid arteries. First is the cervical segment or the C1. This portion of the internal carotid artery, together with the common carotid artery, internal jugular vein, vagus nerve, deep cervical lymph nodes, and sympathetic nerve fibers, runs superiorly through the carotid triangle of the neck covered in the carotid sheath. The second one, the petrous segment, from the carotid canal's entry to the foramen lacerum's posterior margin. Its branches include the cariotico-tympanic artery and the Vidian artery. The third, the lacerum segment, for the foramen lacerum posterior border to the superior margin of the petrolingual ligament. This anatomical structure is located on the wall of the carnivus sinus. The next one is the carnivus segment. It travels superiorly along the sphenoid bone's posterior clinoid process. Within the carnivus sinus, the internal carotid artery travels superior-medially to abducens nerves and medially to oculomotor nerve, trochlear nerve, and ophthalmic and maxillary division of the trigeminal nerve respectively. The branches include the meningohypophyseal trunk and the inferolateral trunk. Fifth is the clinoid segment. It's from the proximal or anterior clinoid process to the distal or the carnivus sinus roof dural ring. The sixth segment is the ophthalmic segment. From the distal dural ring or the carnivus sinus ceiling, the sixth segment travels parallel and horizontal in an inferolateral position with respect to optic nerve. The endpoint of the origin is to the posterior connecting artery. Its branches includes the ophthalmic artery and the superior hypophyseal trunk. And the seventh segment is the communicating segment, from the posterior connecting artery's proximal origin to the internal carotid bifurcation. Its branches include the posterior communicating artery, anterior choroidal artery, anterior cerebral artery, and the middle cerebral artery. And now, let's talk about the ophthalmic artery. So the ophthalmic artery, it is a branch of the internal carotid artery that supplies the orbit and the adjacent structures. The ophthalmic artery mainly runs through the orbital cavity, coursing along its medial wall anteriorly and nasally toward the anterior surface of the eye. The named branches of the ophthalmic artery is the supratrochlear, supraorbital, lacrimal, medial palpebral, and neck external dorsal nasal branches that supplies the face. First is the supratrochlear artery. It emerges from the orbit on the face at the frontal notch. It supplies the medial parts of the upper eyelid, forehead, and scalp, and anastomosis with the supraorbital artery and with its contralateral fellow. The supratrochlear artery is one of the two terminal branches of the ophthalmic artery along with the external or dorsal nasal artery. These terminal branches arise in the superomedial aspect of the orbit anterior to the trochlea. The supratrochlear artery exits the orbit at the frontal notch located on the medial aspect of the supraorbital margin. Next is the supraorbital artery. It divides into superficial and deep branches that supply the skin and the muscle of the upper eyelid, forehead, and scalp. The supraorbital arteries exit the orbit through the supraorbital foramen, accompanied by the supraorbital nerve and vein. The part of the supraorbital artery that is within the orbit supplies the superior rectus and levator palpebrae superioris, while its extraorbital part supplies the skin, muscles, and periosteum of the forehead. Lacrimal artery. It appears on the face of the upper lateral corner of the orbit and supplies the lateral part of the eyelid. It is one of the largest branches of the ophthalmic artery. This artery arises just before the ophthalmic artery enters the orbit. The lacrimal artery mainly supplies the lacrimal gland but also the eyelids, conjunctiva, and parts of the dura mater. The medial palpebral artery. Superior and inferior medial palpebral arteries arise from the ophthalmic artery below the trochlea. They descend behind the nasolacrimal sac to enter the eyelids, where each divides into two branches that course laterally along the edges of the tarsal plates, forming the superior and inferior arch and supplying the eyelids. Lastly, the external nasal artery. It is a terminal branch of the anterior ethmoidal artery which arises from the ophthalmic artery. It emerges at the junction of the nasal bone and the lateral nasal cartilage and supplies the skin covering the external nose. The next artery is one of the major blood supply of the head and neck, which is the subclavian artery. So the subclavian artery is the artery enters the neck behind the sternum. The right subclavian artery arises from the brachiocephalic trunk, the left from the aortic arc. The main function of the subclavian artery is to supply blood to the upper limbs, thorax, neck, and the brain. The subclavian artery gives off several branches that supply various structures of the upper body. These branches can be organized into three groups according to the part of the artery from which they arise. So, in the first part of the branches of the subclavian artery are the vertebral artery, internal thoracic artery, and the thyrocervical trunk, while the second part of the subclavian artery are the costus cervical trunk and deep cervical artery. So let's talk about the first part of the subclavian artery, the vertebral arteries. So the vertebral arteries, it is ascend through the neck inside the transverse foramina of the cervical vertebrae all the way to the brain. Running through the gaps in the vertebrae or the foramen, they access the posterior fossa, a small space at the base of the skull near the brainstem and cerebellum, as well as the occipital lobes of the brain. The arteries in the area not only supply blood to the neck, but they are also the main source of the blood to the brain together with the carotid arteries. There are two cervical branches of vertebral artery. These are the spinal branches and the muscular branches. First, spinal branches, it enter the vertebral canal via the intervertebral foramina and supply the spinal cord and its membranes. Branches from this chain supply the periosteum and vertebral bodies, and others communicate with similar branches across the midline. From these connections, small rami join similar ones above and below to form a median anastomotic chain on the posterior surfaces of the vertebral bodies. The next one is the muscular branches. It arises from the vertebral artery as it curves around the lateral mass of the atlas. They supply the deep muscles of the suboccipital region and anastomosis with the occipital ascending and deep cervical arteries. Next, the internal thoracic artery. It arises inferiorly from the first part of the subclavian artery, 2 cm above the sternal end of the clavicle, opposite the root of the thyrocervical trunk. The artery runs inside the thorax, sitting close to its anterior wall at the level of the first rib. The vessel is crossed anteriorly by the phrenic nerve. It descends through the thorax by traveling parallel to the lateral margin of sternum. The artery runs under the pectoralis major muscle and the first 6 costal cartilages.
The last branch of the first part of the subclavian artery is the thyrocervical trunk. It is a broad channel formed from the first component of the subclavian artery. It runs for a short distance in the anterior part of the neck. This branch develops on the anterior front side of the lower neck, near the scalenus anterior muscle. This arterial trunk has a wide supply territory. It vascularizes the thyroid and parathyroid glands, larynx, pharynx, bronchial plexus, cervical and shoulder muscles, and the adjacent skin. Can have up to 5 branches, but most commonly described are the inferior thyroid, suprascapular, superficial, cervical artery. Inferior thyroid artery. It passes anterior to the vertebral vessels and posterior to the carotid sheath and its contents, and usually the sympathetic trunk whose middle cervical ganglion frequently adjoins the vessel. The artery usually passes behind the nerve as it nears the gland. However, very close to the gland, the right nerve is equally likely to be anterior, posterior or amongst the branches of the artery, and left nerve is usually posterior. The inferior thyroid artery branches off into the arteries that serve the larynx, thyroid gland, parathyroid glands, and other structures and muscles in the neck and throat. These branches are muscular branches, ascending cervical artery, inferior laryngeal and pharyngeal branches. Muscular branches. This supplies the infrahyoid muscles, longus colli, scalenus anterior and inferior pharyngeal constrictor. Ascending cervical artery is a small branch that arises as the inferior thyroid turns medially behind the carotid sheath and ascends on the anterior tubercles of the cervical transverse process between the scalenus anterior and longus capitis. It supplies the muscles of the neck and connects the branches of the vertebral arteries. Inferior laryngeal. It ascends on the trachea and recurrent laryngeal nerve, enters the larynx at the lower border of the inferior constrictor and supplies the laryngeal muscles and mucosa. Pharyngeal branches. This supplies the lower part of the pharynx. Tracheal branches supplies the trachea and anastomose with the bronchial arteries. Esophageal branches supplies the esophagus and anastomose with the suprascapular artery. It descends laterally across scalenus anterior and phrenic nerve, posterior to the internal jugular vein and sternocleidomastoid. The suprascapular artery is sometimes referred to as the transverse scapular artery. Branching away behind and side of the anterior scalene muscle, one of the 3 major muscles of the side of the neck. The suprascapular artery crosses the third part of the subclavian artery as well as the bronchial plexus, a network of nerves connecting the spine to areas in the neck and upper arm. Additionally, it provides small branches that supplies the skin of the upper thoracic cage and shoulders. Superficial cervical artery. It crosses the anterior to the phrenic nerve, scalenus anterior, and branchial plexus, and is covered by the internal jugular vein, sternocleidomastoid, and platysma. It crosses the floor of the posterior triangle to reach the anterior margin of the levator scapulae, and ascends deep to the anterior part of the trapezius, which supplies together with the adjoining muscles and cervical lymph nodes. It anastomoses with the superficial ramus descending branch of the occipital artery. Now let's talk about the second part of the subclavian artery, the costocervical trunk. It arches back about the cervical pleura to the neck of the first rib, where it divides into superior intercostal and deep cervical branches. The deep cervical branch provides supply for the last cervical and first thoracic vertebrae, posterior neck muscle and segment of the spinal cord. The supreme intercostal supplies the muscles, parietal pleura, and skin of the first two or three posterior intercostal spaces. So the origin of the costocervical trunk is located at the level of the lower pole of the inferior cervicothoracic stellate ganglion. Lastly, the deep cervical artery. It is the analogous in its first segment to a posterior branch of posterior intercostal artery, and occasionally is a separate branch of the subclavian artery. It supplies the adjacent muscles and anastomoses with the deep branch of the descending branch of the occipital artery and branches of the vertebral artery.
So, let's just have a quick reminder of what veins do. Veins are blood vessels that mainly drain the oxygenated blood from areas around the body except for the pulmonary veins, which carry the oxygenated blood from the lungs to the heart, where venous blood is returned to the heart where it is pumped to the lungs to be reoxygenated. The ultimate goal for the veins of the head and neck is to bring venous blood to the superior vena cava, which transports blood to the right atrium of the heart. Most veins contain valves, which helps to maintain a unidirectional blood flow. Veins have three concentric layers, or tunicae. We have three layers. Number one is tunica intima, which is composed of endothelial cells and internal elastic lamina. Number two is tunica media. It contains muscle tissue, elastic fibers, collagen, and external elastic lamina. And last is the tunica adventitia, which contains elastic and collagen tissue and muscle fibers. If we simply compare veins and arteries, we can see the comparison here in the table. But simply saying, while arteries have branches, veins have tributaries. Tributaries are smaller veins in which it drains into the larger main veins. We'll meet some of those today. Now, let's look at the blood from veins. If we are going to distinguish the blood from veins, number one is it is dark red in color. Number two is blood flows steadily or it gushes. Next is that veins blood is easier to control. And next is most of the veins collapse when cut. Lastly is that bleeding from deep veins can be massive and it's hard to control as arterial bleeding. Upon classifying veins, we have different classification. Number one is the superficial veins. Its course is close to the surface of the body and have no corresponding arteries. We also have deep veins. Deep veins are deeper in the body and have corresponding arteries. We also have communicating veins, or also known as perforator veins. These are the veins that directly connect superficial veins to the deep veins. We also have pulmonary veins. These are the set of veins that deliver oxygenated blood from the lungs to the heart. And we also have systemic veins. The systemic veins drain the tissues of the body to deliver the oxygenated blood to the heart. Now we are going to talk about the main veins of the head and neck. And we have to tackle an internal jugular vein. We also have to take a look at the subclavian vein, and lastly the brachiocephalic vein. We'll then explore the main tributaries of each of these veins, then describe these specific areas and their tributaries. Now let's go to the internal jugular vein. The internal jugular vein is a paired vessel extending from the base of the skull to the sternal end of the clavicle on each side of the body. Looking at this transverse section through the neck, we can see that the internal jugular vein travels within the fibrous carotid sheath, just lateral to the carotid artery. This vein can be found just deep the sternocleidomastoid muscle and therefore is not usually visible on the surface of the skin. The internal jugular vein is also the main brain drain. It is formed by the union of the sigmoid and inferior petrosal sinus. The internal jugular vein extends down to the neck to drain into the brachiocephalic vein, as we can see in this posterior view of the neck. The green one is the brachiocephalic vein, and as we can see in this posterior view of the neck, it drains venous blood from the majority of the skull, brain, oral cavity, and the superficial structures of the head and neck. Tributaries of the internal jugular vein include sigmoid sinus, inferior petrosal sinus. Please remove the I. Next, we also have meningeal veins, pharyngeal venous plexus, common facial vein, and superior and middle thyroid vein. The sigmoid sinus, which we have already mentioned, collects and drains venous blood from the regions of the brain. It is formed as a continuation of transverse sinuses of the brain. It then drains at the internal jugular vein via the jugular foramen. Now let's go to the inferior petrosal sinus. The inferior petrosal sinus lies at the middle cranial fossa, and it drains regions of the middle cranial fossa, brain, and inner ear. Inferior petrosal sinus originate from the posterior inferior aspects of the cavernous sinuses on each side of the cell turcica, and the inferior petrosal sinus travels through the jugular foramen of the skull to drain into the internal jugular vein. In this image, we can identify one of the many meningeal veins. The middle meningeal veins travels within the meningeal arteries and drain the dura mater, which is one of the meninges surrounding the brain. The meninges are protective membranous layers that envelop the brain and protect the brain and the spinal cord. Moving on to the neck, we find the pharyngeal venous plexus. It is a network of veins which surrounds the pharynx. The pharyngeal venous plexus is formed by the union of the pharyngeal veins posterolateral to the larynx. It drains regions of the pharynx and superficial neck into the internal jugular veins. Next, we have the common facial vein. It drains the superficial structures of the face. This vein is formed by the union of the facial vein and the anterior branch of the retromandibular vein. It travels inferiorly to drain into the internal jugular vein just below the jaw. Another note on the facial vein is it is known as the major vein of the face. After receiving the supratrochlear and supraorbital veins, it travels obliquely downwards by the side of the nose, passes under zygomatics major, risorius, and platysma, descends into the anterior border, and then passes over the surface of the masseter. Then we're going to talk about supratrochlear and supraorbital veins too. So, supratrochlear vein starts on the forehead from a venous network connected to the frontal tributaries of the superficial temporal vein. Veins from this network form a single trunk that descends to the bridge of the nose, near the midline and parallel with its contralateral fellow. The veins are joined by a nasal arc across the nose. They then diverge, joining a supraorbital vein to form the facial vein medial canthus of the eye. Next, we have also supraorbital vein. The supraorbital vein begins near the zygomatic process of the frontal bone, connecting with branches of the superficial and middle temporal veins. It then passes medially above the orbital opening, pierces orbicularis oculi, and unites with the supratrochlear vein near the medial canthus of the eye to form the facial vein. As we can see here, the final tributaries of the internal jugular vein are the superior and middle thyroid veins. These veins originate from a glandular venous plexus. It drains regions of the thyroid gland, and the superior and middle thyroid veins, accompanied with arterial counterparts, cause anterior to the common carotid artery to drain into the internal jugular vein. Superior thyroid vein is formed by deep and superficial tributaries corresponding to the arterial branches in the upper part of the thyroid gland. It then accompanies superior thyroid artery, receives the superior laryngeal and cricothyroid veins, and ends in internal jugular and facial vein. Next is the middle thyroid vein. The middle thyroid vein drains the lower part of the gland and also receives veins from the larynx and trachea. It then also crosses anterior to the common carotid artery to join the internal jugular vein behind the superior belly of the omohyoid. Now let's go to the next main vein of the head and neck, which is the subclavian vein. The subclavian vein is one of the main veins of the neck. It is also a paired vessel with both a left and right counterpart. As its name suggests, it lies tucked just beneath the clavicle. It is formed with the continuation of the axillary vein and joins with the internal jugular vein to form and drain into the brachiocephalic vein, in which also drains the upper limbs and the neck. As we can see here, subclavian vein begins as a continuation of the axillary vein and extends from the outer border of the first rib. Tributaries of the subclavian vein includes the anterior jugular vein, external jugular vein, and the veins of the upper limb. The anterior jugular vein is a paired blood vessel that drains structures of the anterior compartment of the neck. It is formed by the confluence of the submandibular veins just under the chin. It travels down the anterior surface of the neck and strains into the subclavian vein just before it joins the internal jugular vein. The anterior jugular vein can sometimes drain directly into the external jugular vein. The external jugular vein drains superficial structures of the head, including the scalp and face. It is formed by the union of the posterior auricular vein and the posterior branch of the retromandibular vein near the angle of the mandible. This vein travels down the neck superficial to the sternocleidomastoid muscle and drains into the subclavian vein right before it travels or joins with the internal jugular veins as a continuation of the auxiliary vein. The subclavian vein ultimately receives the oxygenated blood from all the veins of the upper limb. So as you can see in this slide, this is just a more broader explanation of what I had said earlier. Now let's go to the main final vein of the head and neck. We meet the brachiocephalic vein. Brachiocephalic vein is also known as the anomenate vein. As we know, the brachiocephalic vein is formed by the confluence of the internal jugular vein and the subclavian vein, just posterior to the sternoclavicular joint, and it drains the venous blood from the regions of the head and neck, upper limb, into the upper part of the thorax. Then it drains into the brachiocephalic vein. After the brachiocephalic vein, it then drains into the superior vena cava and into the right atrium of the heart. The brachiocephalic vein receives four main tributaries, which include the internal jugular vein, the subclavian vein, which we've already discussed earlier, and the other tributaries such as the vertebral vein and the internal thoracic vein. Internal jugular vein begins at the cranial base in the posterior compartment of the jugular foramen, where it is continuous with the sigmoid sinus. At its origin, it is dilated as a superior bulb, which lies below the posterior part of the tympanic floor. The internal jugular vein descends in the carotid sheaths and unites with the subclavian vein posterior to the sternal end of the clavicle and the brachiocephalic vein. Next tributary is the vertebral vein. As its name suggests, the vertebral vein travels along the vertebral column down through the transverse foramina of the cervical vertebrae to reach the brachiocephalic vein. The vertebral vein originates from a venous plexus in the suboccipital triangle and also the other structures such as suboccipital muscles, the prevertebral muscles of the neck, and the cervical spine. It terminates at the base of the neck and drains into the brachiocephalic vein just medial to the internal jugular vein. This is a more comprehensive notes on vertebral vein. Their union provides a vessel that enters the foramen in the transverse process at the atlas and forms a plexus around the vertebral artery. It descends through the successive transverse foramina and ends as the vertebral vein. Then this vein emerges from the sixth transverse foramen, from where it descends at the first anterior, then anterolateral to the vertebral artery. The next tributary we have is the internal thoracic vein. It drains the upper thorax, chest wall, and the breast, and is formed as a continuation of the musculophrenic and the superior epigastric veins of the thorax as it collects venous blood from surrounding structures. The internal thoracic veins travel superiorly to drain into the brachiocephalic vein, as most of the veins in the body are found here. The internal thoracic vein also contains valves, which are vitally important here to prevent the backflow of the blood. Moving on, we also have to discuss the other veins found in the head and neck, such as the inferior thyroid vein. Inferior thyroid vein is a paired vein located at the lower neck. The left and right inferior thyroid veins rise at the inferior poles of the respective lobes of the thyroid gland. They have a short inferior course, each draining into the brachiocephalic vein or subclavian. We also have this superficial temporal vein. It is a widespread venous network across the scalp, and it receives branches from the supratrochlear, supraorbital, and posterior auricular and occipital veins, as what we have discussed earlier. Anterior and posterior tributaries from this network unite above the zygomatic arch to form the superficial temporal vein on each side. We also have the buccal, mental, and infraorbital veins. The buccal, mental, and infraorbital veins drain the cheek and chin. These regions pass into the pterygoid venous plexus. We also have posterior auricular and occipital veins. The posterior auricular vein arises in a parieto-occipital network that also drains into tributaries of the occipital and superficial temporal veins. It then descends behind the auricle to join a posterior division of the retromandibular vein in or just below the parotid gland to form the external jugular vein. It also receives a stylomastoid vein. So again, as a recapitulation of the veins of the head and neck, we have different veins that can be found in the head and neck respectively. These are supratrochlear, supraorbital, facial, superficial temporal vein. We also have the buccal, mental, and infraorbital veins. Another one is the posterior auricular and occipital veins. We can also find the external jugular vein, also the internal jugular vein, subclavian vein, vertebral vein, inferior thyroid vein, superior, and the middle thyroid vein. Let us remember that three main veins of the head and neck are the internal jugular vein, the brachiocephalic vein, and the subclavian vein. I hope you have learned something in my discussion, and now let's move on to the next topic, which is the lymphatics of the head and neck, to be discussed by my fellow groupmates.
The third topic is lymphatics of face and neck. The lymph nodes of the face and neck are part of the lymphatic system, which plays a crucial role in the body's immune response. Lymph nodes are small bean-shaped structures scattered throughout the body, and they filter lymphatic fluid to remove waste products, pathogens, and abnormal cells. Lymph nodes in the face and neck region. The first one is preauricular lymph nodes located just in front of the ears. Lymph nodes occur in the skin overlying the parotid gland or pericular lymph nodes and in the substance of the gland. The lymph nodes filter lymph fluid entering the body throughout the scalp, neck, and other facial areas. They are critical to the immune system functioning. Particular lymph nodes can swell or grow in response to a variety of events including infections, dental problems, allergies, and systematic diseases. Next is the posterior auricular lymph nodes found behind the ears near the base of the skull. It is a system of veins and nodes that help to circulate lymph fluid and maintain the body's immune system. These are in charge of filtering and trapping extraneous substances that may infiltrate the tissue surrounding the ear, such as bacteria, viruses, and other diseases. Lumps behind the ear can be caused by a variety of factors including localized injury, infections, or internal inflammation. Occipital lymph nodes, situated at the back of the head and drain the scalp. Occipital lymph nodes are a set of lymph nodes positioned outside of the occipital bone rather than within the skull. They are active participants in the body's immunological defense system. The occipital lymph nodes are part of lymphatic system which filters and purifies lymph fluid as well as produces and activates immune cells.
Submental lymph nodes located under chin in the midline. Submental lymph nodes are made up of lymphatic tissues surrounded by fibrous capsulae. They contain white blood cells which help to fight infection and spread. They function as filters, removing potentially hazardous germs and bacteria from lymph fluid draining from teeth and inside of the mouth. These lymph nodes are positioned near the mylohyoid muscle. They collect lymph from the lower lip center, the floor of the mouth, and the tip of the tongue. Dental infections, mouth infections, sore throats, and localized skin infection are all common causes of submental lymph nodes growth. Submandibular lymph nodes, found below the lower jaw near the angle of the mandible. Submandibular lymph nodes lie between the submandibular salivary glands, behind the tongue and the mandible. One or more lymph nodes may become buried deep within the salivary glands on rare occasions. Swollen submandibular lymph nodes can sometimes be a sign of more serious ailment, such as mouth infection, dental issues, or even certain types of cancer.
Superficial cervical lymph nodes is positioned along the sides of the neck, superficial to the sternocleidomastoid muscle. A collection of lymph nodes along the external jugular vein on the superficial surface of the sternocleidomastoid muscle. They primarily receive lymphatic drainage from the posterior and posterolateral regions of the skull through the occipital and mastoid nodes, and send lymphatic vessels in the direction of the deep cervical node. The next one is the deep cervical lymph nodes, is situated deeper within the neck, alongside the internal jugular vein and internal carotid artery. The deep cervical lymph nodes play a crucial role in filtering lymphatic fluid and participating in the immune response. They contain lymphocytes and macrophages that help trap and destroy foreign particles, pathogens, and cellular waste materials. These nodes are particularly involved in defending against infections, inflammation, and diseases affecting the deep tissues of the head, neck, and throat. Next is the jugulodigastric lymph nodes, also known as the tonsillar lymph nodes. They are located near the angle of the mandible and drain the tonsils. They are situated at the junction of the jugular vein and the posterior belly of the digastric muscle, hence the name jugulodigastric. These lymph nodes are considered part of the deep cervical lymph node group. For the superficial parotid lymph nodes is found near the parotid gland, which is the largest salivary gland situated in front of the ear. Superficial parotid lymph nodes are divided into three groups determined by the embryological development of the parotid gland. First is the superficial extrafacial. The superficial extrafacial group nodes are located superficial to the superficial layer of the deep cervical fascia. They are usually pre-auricular placed close to the tragus but can be located along the notch between the tragus and antitragus. Second is the subfascial extraglandular. The subfascial group lies near the superior nuchal line of the occipital bone, beneath the superficial layer of the deep cervical fascia. The deep intraglandular nodes, the submuscular or subsplenius, or deep occipital groups are more constant in location. They lie beneath the superior insertion of splenius capitis, above oblique capitis superior, and medial to the longissimus capitis. Lastly, the retropharyngeal lymph nodes is situated deep within the neck, behind the pharynx. The retropharyngeal lymph nodes play a role in the immune system's defense against infections and inflammations in the nasopharynx, oropharynx, and upper respiratory tract. They receive lymphatic drainage from these areas, including the posterior nasal cavity, tonsils, adenoids, and the back of the throat.
Since we're done discussing the veins and the arteries as well as the lymphatic drainage of the neck and face, now we are going to discuss the relationship of the two systems. We are going to talk about the relationship of lymphatics and the blood supplies of the neck and face. Now, for this topic, for the relationship of the two systems of the head and neck, I have made 4 points. Number one is the lymphatic drainage. You also have the lymph nodes, blood supply, and the arterial lymphatic relationship. Main point of the relationship of the two systems is the lymphatic drainage. If we can simply say this, it is a fluid transport. The lymphatic system is responsible for collecting and transporting lymph fluid away from the tissues, in which the lymph fluid contains the following: waste products. It also contains pathogens and immune cells. These lymphatic vessels work in parallel with blood vessels to drain excess fluid and return it to the circulatory system. Lymphatic vessels run alongside blood vessels, and their networks often follow similar pathways. Now, as we can see, upon looking at this illustration, we can see that throughout our body, interstitial fluid or fluid found in the spaces around cells leaks from blood capillaries into our tissues. Lymph capillaries pick up this fluid and return it to our circulatory system, in which, in essence, ang ibig sabihin nito is that the body, the circulatory system, does not rely on its own only, na hindi lang niya kaya, hindi makakapagsulo ang circulatory system with the veins and the arteries cannot function fully by its own. Thus, meron silang need kay lymphatic drainage, because this lymphatic drainage, kinukuha nga nila yung nagli-leak from the blood capillaries, and what they get from that is finifilter nila, and also it returns clean back to the circulatory system. Next main point is the lymph nodes, or we can commonly term it as filters. The neck and face have bean-shaped lymph nodes. They filter lymph fluid and kill infections and aberrant cells. Lymph nodes are carefully placed along lymphatic channels and close to major blood vessels. Lymphatic drainage from the scalp, face, and neck to the lymph node is essential for immune response and illness diagnosis. One application of this is whenever we are not feeling well. For example, meron tayong ubo or sipon. We can palpate it that sometimes yung kulani natin dito is like maga. Nagkakaroon tayo ng inflammation of the lymph node on some spots, areas of our body. So this is a manifestation that our immune system is working and there is a possible infection that's going on with our body. Another main point of the relationship is the blood supply, or also known as circulation. Arteries and veins give blood to the neck and face. Veins return the oxygenated blood to the heart, while arteries, they supply oxygenated blood to the tissues. Blood vessels deliver oxygen and nutrients to the neck and face cells, in which it supports metabolism and tissue health. In short, these veins and arteries are very important in relation to our face and neck, since they nourish and vitalize our tissues that is forming our head and neck, including the scalp, the skin, and also this creates a continuous supplement of nutrients that is necessary for our living. If we are going to recall what we had discussed earlier on the circulatory system, again, basically arteries transports oxygen from the heart to the body, whereas capillaries carry blood between arteries and veins. And also, when we have talked earlier that this capillary leak interstitial fluid, in which the lymphatic drainage also gets the lymph fluid, in which they filter the toxins and also return it to the circulatory system. And also, the veins return the oxygenated blood to the heart. And this These structures of the circulatory system and the lymphatic system are very essential in regards to the movement of the blood towards the head and neck, because without it, wala tayong magta-travel ng blood into our head and neck. So the final point of this relationship is the arterial-lymphatic relationship. We can term it as the synergy of the two systems. Lymphatic veins and arteries frequently cross each other in close proximity. A pressure gradient is produced by the arteries as they transport nutrients and oxygen to the tissue, aiding in lymphatic drainage. The lymph fluid is propelled through the lymphatic channels by the positive blood flow in the arteries, which helps with effective waste disposal and maintains the proper fluid balance in tissues. In this illustration, we can see the relationship of the two systems, the blood supply and the lymphatic drainage. In the arterial system pumps the oxygen-rich blood, and then it goes into the smaller arteries and then into the capillaries or the capillary network. Since, as we already discussed last time, that the capillaries also have a pressure gradient due to the arterial pressure, the lymphatic, there is a leakage of the interstitial fluid in which the lymphatic capillaries pick this up and then proceeds into filtering through the help of the whole lymphatic drainage system. After that, since the blood exchange happens within the capillaries, the blood now is low in oxygen. It is now collected into the smaller veins and go to the bigger veins and into the right directly into the back into the heart with the help of the venous system.
In this part, I will discuss the only clinical correlation that I have found in the Gray's Anatomy 41st edition book that we use: spread of malignant disease in the neck. Cancers in the head and neck region have predictable patterns of spread through lymph nodes in the neck. Understanding these patterns of spread is crucial for determining the appropriate surgical intervention for each individual cancer. Lymph nodes in the neck can be classified into 5 distinct groups: Level 1 to Level 5. Level 1 nodes are located in the submandibular triangle, bounded by the anterior and posterior bellies of digastric and the lower border of the mandible. Level 2 nodes are found around the upper portion of the internal jugular vein and the upper part of the accessory nerve. Level 3 nodes lie around the middle third of the internal jugular vein. Level 4 nodes are located around the lower third of the internal jugular vein. Level 5 nodes are found around the lower part of the accessory nerve and the transverse cervical vessels. Understanding which levels of nodes are likely to be involved in metastatic spread helps determine the appropriate nodal clearance during surgery. The classic radical neck dissection, described by Krill in 1906, involved a thorough clearance of levels 1 to 5 and sacrificing sternocleidomastoid, the internal jugular vein, and the accessory nerve. Modified radical neck dissections still removes level 1 to 5 nodes but spare one of more of sternocleidomastoid, the internal jugular vein, and again the accessory nerve. Selective neck dissections remove selected groups of nodes such as supraomohyoid neck dissection, lateral neck dissection, and posterolateral neck dissection.
Another clinical consideration is the carotid sign syndrome. As we can see in the graphic, that it is a result of consciousness due to simple head movement. It also relates to the hypersensitivity of the carotid sinus due to an unknown etiology. Sudden slight pressure changes, such as that occasioned by movement of the head, may result in stimulation of the carotid sinus. Lastly, impulses relayed by the sinus reduce blood pressure and slow the pumping action of the heart, thus decreasing blood supply to the brain and resulting in sudden loss of consciousness. Another clinical consideration would be the sublingual artery damage. The sublingual artery, occasionally injured during dental procedures, may present problems to the surgeon attempting to ligate its source because it may arise from the submental branch of the facial artery rather than from the lingual artery. Um, Lastly is the epistasis. So you can also call it or term it as nosebleed. Nosebleed is the bleeding from the nose subsequent to injury of the nose, and it is a common occurrence and is usually relatively easily controlled. Normally, the source of blood flow is the back area, the mucosa of the anterior inferior region of the nasal septum, where the septal branch of the superior labial, anterior ethmoidal, nasopalatine, and greater palatine arteries anastomose. The bleeding is controlled by pressure or by packing the nose with cotton. Occasionally, bleeding is from higher up in the nose, where control may require more heroic action. When the injury is from a direct blow, the cribriform plate of the ethmoid bone may be fractured.
Sixth topic, importance. Understanding the blood supply and lymphatics of the head and neck is essential for healthcare professionals to provide accurate diagnosis, plan appropriate treatments, optimize surgical outcomes, and ensure overall patient well-being. Therefore, they are of significant importance due to several reasons. For oxygenation and nutrient delivery. Adequate blood supply is vital for delivering oxygen and essential nutrients to the tissues of the head and neck region. This ensures the proper functioning of organs such as the brain, eyes, and facial structures supporting their metabolic needs. Waste removal and toxin clearance. The lymphatic system plays a crucial role in removing waste products, toxins, and excess fluid. Efficient lymphatic drainage helps maintain tissue health, prevents the buildup of harmful substances, and supports the body's overall detoxification process. Immune system function. The lymphatic system is closely associated with the immune system, as it transports immune cells such as lymphocytes throughout the body. In the head and neck region, lymph nodes act as filtering stations where pathogens, foreign particles, and abnormal cells are trapped and destroyed, contributing to immune defense. Diagnostic and therapeutic relevance. Understanding this topic is crucial for diagnosing and managing various medical conditions. For example, abnormalities in the blood vessels or lymphatic vessels can indicate vascular disorders, infections, or tumors. Additionally, knowledge of the anatomy helps guide medical procedures such as lymph node biopsy or surgical intervention. Surgical considerations. Surgeons performing procedures in the head and neck region need a comprehensive understanding of the blood supply and lymphatic drainage to ensure patient safety and optimize surgical outcomes. Precise knowledge of these systems helps avoid complications, plan incisions, preserve vital structures, and achieve effective tissue healing. Dental and maxillofacial considerations. Dentists and maxillofacial surgeons require a thorough understanding of this topic for various dental and facial procedures. For instance, knowledge of the blood supply helps prevent excessive bleeding during oral surgery, while awareness of lymphatic pathways is important for managing infections or swelling in the orofacial region.
So yeah, that concludes our report on blood supply and lymphatics of the head and neck. We tackled the basics of the circulatory system as well as the lymphatic system. We also tackled the veins as well as the arteries of the head and neck as well as their tributaries and the branches of it. We also discussed the lymphatics, the lymph nodes, and the lymphatic drainage, as well as the clinical importance, the relationship of the two systems, and the I hope you learned something about our topic, even though it's too complex. We hope that you understand or learn something in this report. So I guess this is it. Thank you, everyone, and have a great day ahead.